Hello and welcome to Module 6 of the Global Health Starter Kit, Environmental Health, co-authored by Donna Hackley and Ahmad Pokrael. This module introduces environmental health concepts and considers the health and oral health implications of environmental exposures. While there are numerous resources and references available about these topics, for the purpose of this module, we have curated a small sample of high-quality resources to support the learning outcomes. We encourage learners and educators to explore the literature further beyond what is contained in this module. This module is designed to be completed in approximately 1 hour. This module is related to the above competencies. While these competencies cannot be met through a single teaching module, this module is working toward competency-based best practices in global health for dental education. Module 6 aims to meet the following learning objectives. Define key terms related to environmental health, environmental justice, climate change, and the concept of One Health. Explain the environmental health pathway and how some ill health can be attributable to environmental factors, and describe ways in which oral health care personnel might adversely impact environmental health.
Environmental health and its relationship with human health, as well as its degradation resulting from human activities, is an enormous and critically important contemporary topic. We aim in this module to introduce foundational concepts of environmental health and its relationship to human oral health. We urge you to take a deeper dive into the material by way of the supplemental resources we offer. So let's get started. In the early 1500s, Paracelsus spoke about environmental exposures and theories of metabolism, not supernatural vapors or spirits as causes of illness. And his famous point is that the dose makes the poison, meaning that nothing is without potential for harm, but the dose makes it a remedy or a poison. Cholera is a diarrheal disease caused by a bacteria in contaminated water. In the mid-1800s, John Snow figured out that the London cholera outbreak was from a contaminated well at the Broad Street pump, and he helped the community. In 1962, Rachel Carson released her book, Silent Spring, on pesticides' effect on the environment at large, inspiring the formation of the U.S. Environmental Protection Agency in 1979. As you learned in previous modules, we need to have just a few working definitions so we can communicate in this space of environmental health. It's important to note that in the 1948 WHO definition of health, mental and social well-being are included, that health is not simply the absence of disease. An important point about public health is that it aims to prevent disease, promote health, and prolong life among the population as a whole, unlike medicine, which focuses on the individual. Environmental health includes all aspects of human health, including quality of life, that are determined by physical, chemical, biological, social, psychosocial factors in the environment, and shouldn't be confused with the health of the environment. It is the status of human health that comes from factors in the environment. Most important for us here is what we mean by global oral health. We are interested in a public health approach considering the whole population and thinking about common determinants like environmental exposures. What makes this module unique from other environmental health courses is that we are looking through the lens of oral health when we think about the effect of environmental conditions like air quality, water quality and quantity and heat on oral health, and the ways that the delivery of oral health care services impacts our environment through our carbon footprint and the waste we produce. You are probably already familiar with our last few key words. Can you match these? Our environment refers to all components of Earth, such as land, water, air, living and non-living organisms. An ecosystem is all of the living plants, animals, microorganisms, and non-living air, water, and rocks in a certain area, such as an area of a forest, grassland, or desert. Pollution is a general term that means any contamination of a natural environment, while pollutants are the actual substances that cause the air, soil, water, or other natural resources to become unhealthy to use. Pollutants can be chemicals, like pesticides, or metals, like lead or mercury. They can be biologic agents, like pollen, bacteria, mold, or viruses. Pollutants can even be physical agents, like noise, light, or vibration. Or pollutants can be radioactive, like nuclear waste. The WHO recently estimated that 26% of the global population, that's 2 billion people, lacked safely managed drinking water, meaning water that is available at home and is safe. 46% of the global population, 3.6 billion people, lacked safely managed sanitation, meaning access to a toilet or latrine that leads to treatment or safe disposal of human waste. 29% of the global population, 2.3 billion people, did not have access at home to a hand washing facility with soap and water. Also, according to the WHO, 9 out of 10 people breathe air that exceeds WHO pollution limits, with low and middle income countries suffering from the highest exposures. Do you know that air pollution kills an estimated 7 million people worldwide every year? In 2020, the average temperature across the Earth's surface was nearly 1 degree Celsius warmer than the 20th century average, and 1.2 degrees warmer than the pre-industrial period, which was 1880 to 1900. That extra heat is driving extreme temperatures, reducing snow cover, intensifying rainfall, and changing habitats. The amount of waste produced is influenced by economic activity and population growth. The management of waste may result in harmful chemicals in the waste entering the environment. These are the 4 most significant global environmental issues today. Let's look at how these environmental problems can affect our oral health. You'll recall that in Module 4, we discussed social determinants of health and gave an example of water access in Alaska. For the first time in history, Alaska's permafrost is thawing, and this is affecting the water sources. For example, in Bethel, Alaska, local community members recently reported changes in the quality of their natural water sources, resulting in unusual migratory patterns of salmon, one of their regular food sources. They also reported a displeasing taste and odor to their water, which has led them to add flavorings and sweeteners to make their water more drinkable, and this has put them at higher risk for obesity and dental decay. It turns out that the caries rate for children in Bethel was double that of children in the same age in the lower 48 states. Nearly 65% of Bethel's population identifies as Indigenous American Indian or Alaska Native. Remember that vulnerable populations are most at risk to suffer the environmental effects and least able to manage them with their available resources, which widens the gap of health inequity. Probably the most well-known impact on oral health of an environmental exposure is that of fluoride in water. Community water fluoridation is the practice of adjusting fluoride levels in community water supplies up or down to optimize benefits and minimize any risk. Adding a small amount of fluoride to community water can reduce dental decay by 25%, and community water fluoridation was named one of the top 10 public health achievements of the 20th century. But levels above the recommended amount can increase the risk of dental fluorosis, leading to a discoloration of teeth. How does this relate to environment? In some cases, fluoride in groundwater can exist naturally at very high levels, well above recommended limits. We have seen this around the world, including in the American Southwest, the Rift Valley of East Africa, and in areas throughout Bangladesh, for example. With warmer temperatures, people drink more water and so ingest more fluoride. Removing excess fluoride can be difficult and expensive, leaving some populations with no choice but to drink the affected water, causing what has been nicknamed brown stain of teeth. Let's think further about how the environment drives our health. 3 basic environmental drivers of health are emerging infectious diseases, climate change, and environmental exposures. The extent to which our health outcomes are impacted by these is influenced by the level of equity we experience in our life circumstances. Certain populations are especially vulnerable to adverse health effects from these drivers and less able to manage the effects. Let's look at our first bucket, climate change. As you may know, climate change is the long-term alteration of temperature and typical weather patterns in a place. We know that carbon dioxide, or CO2, and other greenhouse gases trap heat from the sun inside the Earth's atmosphere, and this keeps our planet at a life-sustaining temperature. By burning fossil fuels like oil and gas, we are releasing extra gases that trap too much heat and cause the surface temperature of the Earth to rise. Today, CO2 is at its highest level ever since 450,000 years ago. The rising temperature is causing stronger storms, heavier rains, and longer droughts, all of which affect ecosystems and health, including oral health. Exposure to excessive heat can directly cause heat stroke or dehydration. The increased frequency, intensity, and duration of extreme weather events like storms, droughts, and wildfires can directly cause injuries or death. Those injuries might include orofacial injuries. Climate effects can also directly affect food production and water quality, impact sanitation, exacerbate disease risk, including infectious diseases. Extreme events can also lead to significant property damage and loss. Now let's consider indirect effects of climate change. Increases in CO2 levels raise the level of air pollution that we are exposed to. Higher temperatures for longer stretches of time mean that pollen seasons are more widespread and last longer. Pollen and air pollution increase the risk of asthma. So, climate change, by way of worsened air quality, can lead to lung disease and allergic disorders. We know from studies that patients with asthma have higher rates of dental caries. So that makes me wonder, is it possible that climate change indirectly affects dental decay? We need to study that. There are other examples of indirect health effects of climate change. Disease-transmitting insects are cold-blooded, so warmer temperatures speed up their life cycles, causing them to breed more quickly, and warmer temperatures allow them to live in a wider variety of locations. Some of these diseases cause oral lesions, such as Zika virus, dengue fever, and Lyme disease. To think about other possible oral health impacts of climate change, please take a look at my short article, and the link is provided. Climate change affects the environment, and those changes cause health and behavior changes in human and animals. Let's look at why climate-related behavior change is important to health. The proximity and interrelationships between human, animals, and the environment are recognized within a field known as One Health. Today, more people live in closer contact with wild and domestic animals, and this means there are more opportunities for diseases to pass between animals and people. Trends of a growing global population with increased urbanization, climate change, deforestation, environmental contamination, and intensive farming practices all disrupt animal habitats and human or animal behaviors and can provide new opportunities for diseases to jump between animals and between animals and humans. This is thought to be part of the explanation of how the current COVID-19 pandemic began. Remember, all of this takes place within the context of equity, where sociocultural disparities put more vulnerable populations at greater risk of health problems due to environmental factors. An example of zoonotic disease is, of course, the COVID-19 pandemic, which you can learn about in detail in Module 7. Here, we'll consider the Ebola outbreak of 2013, which killed more than 11,000 people in West Africa. Ebola virus causes hemorrhagic fever and is carried by fruit bats. Because of droughts and deforestation, both bats and humans changed their foraging behaviors. Bats and other animals became more concentrated around fruit trees, allowing the virus to spread to intermediate animals, the bushmeat that's sold in markets. Once humans were infected, the virus spread by human-to-human contact in the community, from patients to caregivers, and by burial practices and travel. In addition to emerging infectious diseases, another big concern within the One Health framework is the problem of antibiotic resistance, which happens when bacteria, viruses, and fungi develop the ability to survive against the drugs that should kill them. This occurs in humans and domestic animals, and it is a serious and growing problem. There are no new classes of antibiotics on the horizon, so we need to prevent resistance to the drugs that we have. In the US, antibiotics are used 4 times as much in animals compared to humans. Globally, 500 million households depend on small-scale farming of poultry and livestock, and they use easily available antibiotics as a routine method to keep their animals healthy. The WHO developed a global action plan to track drug-resistant infections and push for decreasing antibiotic use on healthy animals. So why is this important for oral health care providers? Because we must make sure that we are using antibiotics appropriately, only when they are needed, and as they are intended. If we overuse or overprescribe them to our patients, we contribute to the global One Health problem of antibiotic resistance. In addition to climate change and emerging infectious diseases that we just discussed, the last bucket of health drivers that we'll consider is environmental exposures to pollutants that cause disease. The exposure to a contaminant can be something infectious, like a virus, or non-infectious, like a chemical. Environmental health scientists often use a pathway diagram to understand health effects from an exposure to a pollutant and to use information to manage or even prevent exposures and illnesses. Now let's look at the classic 3-box model. First, we need information about the source of the contaminant, like what it is and where it comes from. Next, we need to know how it travels through the environment and how it enters our body. Inhalation, ingestion, or absorption through the skin. Lastly, we need to understand the health effects that this agent causes. Let's look at a recent example in the United States using the 3-box model. In 2013, the city of Flint, Michigan was suffering a severe financial crisis, and so city leaders decided to switch water sources from the nearby Lake Huron in Detroit, which was more expensive, to the Flint River, which was cheaper. But they didn't treat the water properly. Many water pipes in the U.S. are made from flexible lead and sturdy iron. Usually, pipes and water are treated so the lead cannot leach out into the drinking water. The Flint River water wasn't treated properly, so lead leached out of the pipes and into the drinking water. Worst of all, officials knew there is no safe level of lead exposure, especially for children. Lead is a neurotoxin and affects developing brains of children, resulting in behavioral and cognitive challenges. There are many videos on YouTube about Flint's water crisis. We've provided just one of those links for you here. So let's consider the example of lead poisoning in terms of the classic 3-box model. Lead is the contaminant, and its source was the old water pipes. Lead entered the human body through, in this case, ingestion of drinking water. One of the health effects is poor neurodevelopment in children, which is irreversible but preventable. Some scenarios can be very complicated, and environmental health scientists investigate in great depth using health risk assessments and toxicology and epidemiology data to understand the sources of harmful agents and how they travel through the environment to reach people and what health effects they cause. Interestingly, this case also relates specifically to oral health. Previous water sources had been fluoridated. The Flint River water was not fluoridated, and today, there is no public trust in the clean and fluoridated water supply, so people are using bottled, non-fluoridated water. Water fluoridation is thought to be one of the best public health achievements of the 20th century and significantly reduces levels of caries. Flint's children show higher rates of dental caries than the rest of the state. The lack of fluoridated water can only increase this risk. You can read more about this at the link provided. Now, something else about the Flint case is important. the concept of environmental justice. Let's stop for a moment and see where we are. We learned basic terms and principles related to environmental health, and we discussed 3 buckets of drivers: climate change, emerging infectious diseases, and environmental exposures. And we've just heard a case that leads us to ask the question, do environmental health issues affect us all equally? Environmental justice means that everyone has the right to equal environmental protection to live, work, and play in communities that have safe and healthy living conditions. This right should not depend on race, color, national origin, social status, or income. Whether it's contaminated drinking water in Flint, electronic waste disposal in Ghana, mining in Mongolia, or shipping plastic waste to Asia, no group of people should bear a disproportionate share of the negative environmental consequences from human activities and policies. But the fact is that certain populations, those with low incomes, racial and ethnic minorities, immigrants, children, the elderly, and people with chronic diseases or disabilities, are especially vulnerable to experiencing injustice and adverse health effects from environmental pollutants. Let's look again at the case of Flint's water crisis. Today, 54% of Flint's population identifies as Black or African American, and 39% identify as white. 39% live in poverty. Compare these numbers to the state of Michigan, which reports 14% Black or African American, 79% white, and 13% living in poverty. The residents of Flint are historically marginalized and are disproportionately vulnerable to negative environmental health outcomes. The ex-governor and 8 other officials are still facing criminal charges ranging from willful neglect of duty to obstruction of justice to involuntary manslaughter. Recently, the residents of Flint were awarded a partial settlement of $626 million for those who were children at the time of the crisis. The city now has a clean water source and it's fluoridated. The city has given water filters to all residents and replaced lead pipes with copper ones. However, the community's trust of the public water supply is not there. Matters on environmental justice happen at the global level as well. In response, the United Nations developed the concept of sustainable development that provides a shared blueprint for peace and prosperity for people and the planet, now and into the future. In 2015, the UN adopted 17 Sustainable Development Goals, or SDGs, and 5 of those are linked to the environment and health. For example, Goal 6 is related to clean water and sanitation. Goal 7 is connected to affordable and clean energy. And Goal 13 is connected to climate action. We've provided resources for those of you who are interested in learning about the SDGs in greater detail. You'll recall back in Module 2, we learned about key events related to global oral health on the World Development Timeline from 1990 to today. The UN Sustainable Summit and the 17 SDGs were marked in 2015. Let's add a few other important events that relate to human health and the environment. These are only a handful of initiatives that have achieved international support. We've supplied links for those of you who want to take a deeper dive. These conventions and treaties all have at their core the goal of protecting our environment and our health. More clean water, less greenhouse gases, less environmental pollution, slowing climate change. This is a very active field. The Intergovernmental Panel on Climate Change is a UN body that formed in 1998 and aims to provide governments at all levels with scientific information they can use to develop climate policies. Their 6th and latest report was just released this year. Now let's look closely at one convention that directly impacts us as oral health professionals, the Minamata Convention on Mercury. The Minamata Convention directly relates to the practice of dentistry in that our long-used restorative material, dental amalgam, contains mercury. The convention calls for a phase down of the use of dental amalgam, not a complete phase out. recognizing that in some places, dental amalgam may be the only material available, and not wanting to adversely affect vulnerable communities, phasing down is acceptable. The World Dental Federation calls for action in 3 key areas related to the Minamata Convention. 1. Better oral disease prevention methods that will result in less dental disease needing treatment and so less need for amalgam. 2. Other restorative materials must be developed and made available globally. And 3. Amalgam waste management must be effective to protect the environment and human health. This is a great example that shows our oral healthcare relationship to greater global health initiatives. We're heading into our last section. Let's sum up where we are. We started with some background information of environmental health and working definitions. We discussed climate change and the environmental health pathway. We considered how human health, including oral health, is affected. And we've touched on concepts of environmental justice, as well as how environmental health is a part of the Sustainable Development Agenda and various global initiatives. Let's bring our session to a close by considering this question. What can we do as oral health professionals to protect the environment and thereby protect health? It's clear from the various global climate initiatives that lessening our adverse impact on the environment, whether that means greenhouse gases, plastics, or mercury, is a critical step that each of us can take. Waste we produce in our profession can be categorized in 4 basic groups. Infectious waste is any waste suspected to contain pathogens. That's disease-causing bacteria, viruses, parasites, or fungi. And is any waste contaminated with blood or bodily fluids like saliva. Infectious materials should be disposed of according to established guidelines. However, it's possible to use less disposable products, especially single-use plastics, by using, for example, sterilizable metal air-water syringe tips and metal high-speed suction tips. What others can you think of? Our domestic waste includes paper from our clerical activities and foods, cans, or plastic bottles from meals taken by ourselves and our staff. To reduce our domestic waste in the office or at home, think to reduce, reuse, and recycle materials. Discard items into the trash only as a last resort. We can even consider composting of certain foods and paper waste. Mercury from dental amalgam and silver and lead from taking and processing dental x-rays are the possible sources of hazardous wastes that come from a dental care setting. Hazardous waste must be disposed according to safe regulatory guidelines and by using designated waste management companies in your community. Dental amalgam, lead foils from x-ray packets, and x-ray processing solutions should never be dumped into the regular domestic waste stream or washed down the common sewer. Other waste outputs include pharmaceutical waste, electronic or e-waste, like mobile phones, computers, tablets, particulate matter that enters the air from burning our non-recycled waste, and greenhouse gases from our transportation to and from work. Do you really know what's in your waste? The best way to know is to conduct periodic waste audits. We've attached a link with information on how to conduct a waste audit. There are likely areas where you can improve your waste management, reduce your energy and water use, and reduce your carbon footprint. Do you keep the tap water running when you brush your teeth? Do your office computers stay on even when they're not in use? How often do you require delivery of supplies or request a lab to pick up your cases? Please take a look at the links we provided for many more ideas for you to consider. Where does our carbon footprint come from? Well, a recent publication indicated that the #1 contributor to England's dentistry-generated carbon footprint was transportation of dental personnel and patients to the dental office. If you're interested to know more, we've added that link. Let's think back to Module 5 when we learned about dental volunteerism and outreach brigades. You've probably participated in an effort like this. Take a moment to think about the environmental impact of the activity. How much extra transportation was involved? By bus? By plane? How much excess packaging was left behind for local people to deal with? Was recycling available? Will all of the trash have to be burned? What materials besides plastics could have been used? In the true spirit of community-based activities, let's train ourselves to think about waste generation and management, environmental health and environmental justice before we enter the community, so that we truly respect everyone's human right to health. Climate change is here, and it's happening now. If the space where you work were suddenly damaged by a climate event, what challenges might you face? Extended power outages? Complete office destruction or closure? Loss of patient records? Downed communication or disrupted medical supply chains? The key is to think about these and more in advance and prepare a plan to manage the event. Okay, we made it. Here's our 60-second wrap-up. Do you remember Dr. Tooth and Joe? We learned in Module 2 that Dr. Tooth knows that for Joe to receive dental care, he must have to overcome various social determinants, such as language barriers or finding a way to pay for his care, just to name a few. Well, a lot of time has passed since Joe has come to see Dr. Tooth, and today he presents with a very painful toothache. Dr. Tooth already knows that Joe understands about personal disease prevention by good oral hygiene practices and a healthy diet. Dr. Tooth also knows that Joe was able to access care previously, but today, Joe's BMI has increased, his oral hygiene is poor, and there are several new cavities in addition to this painful toothache. All of this puzzles Dr. Tooth, so he begins to ask Joe what's happened. It turns out that Joe lives on the coast and has experienced terrible storms and flooding. Environmental scientists being interviewed on TV say that the severe weather is related to climate change. Joe has had no way to get clean water for cooking, drinking, or personal hygiene, and no way to find fresh foods since local farms were destroyed in the flood and the supply chain was disrupted because of damaged roads. Joe's lack of oral hygiene and his increased consumption of sugary drinks have led to this large and painful cavity. Joe has been furloughed from work until the storm cleanup and recovery finishes, which is taking months, and public transportation has been intermittent at best. Fortunately, Dr. Tooth's practice prepared in advance for adverse weather events. They were able to access Joe's dental record electronically and power their office with a generator. They had procured enough supplies in advance that the clinic could still function and allow Dr. Tooth to provide care to Joe. So that brings us to a close for Module 6, Environmental Health. I hope you enjoyed learning this new content and feel inspired to dig deeper on these concepts and to translate them into your practices at home and in your workspace. Thank you.